Good morning, everyone. Thank you for joining PHCA for today's webinar, Bridging from Bronze to Silver, Continuing the Quality Award Journey. I'm Wendy Johnson, Executive Assistant for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and gain a better understanding of practical application tools to equip our members so that you may continue to provide the highest level of quality care possible. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on PHCA's website by no later than the close of business today. The webinar has been approved for 1 continuing education credit for nursing home, assisted living, and personal care administrators. Certificates will be emailed by close of business today, along with a link to a survey. Please complete this survey, and if you are participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane, and our presenter will address them at the end of her presentation. Now for today's webinar. The purpose of this webinar is to assist Bronze Level Award recipients to determine their next steps on the quality journey to apply for the Silver Level Quality Award. Skilled nursing centers will also learn how to integrate the Baldrige Principles into the components of the facility assessment required in Phase 2. An overview of all of the Silver Level Award applications will be provided, along with the key considerations to determine readiness for applying for the award in 2018. Your learning objectives for today are: number 1, describe the process for completing the Silver Level Quality Award application for nursing centers, assisted living, and personal care communities. Second, outline for skilled nursing centers how the Baldrige Principles align with components of the required facility assessment and QAPI plan to meet the Phase 2 requirements of participation. The third objective is to discuss common pitfalls and share tips for completion of the Silver Level Quality Award application. And last, identify steps to identify readiness and create an action plan to complete a Silver Level Award application. Today's webinar is presented by our very own PHCA Director of Quality Initiatives, Don Murr-Davidson, and I'm going to turn it over to Don now. Don, the floor is yours.
Thanks, Wendy, and welcome, everyone. Good morning. We have a great representation today of both assisted living and assisted living, personal care, and skilled members on the call. First, I would just want to take a minute and congratulate everyone for achieving the Bronze Level Quality Award, and welcome you to the next part of the Quality Award process, which is looking to go for Silver. I'm excited to report that this year in Pennsylvania we had 5 Silver Award winners, and that's quite a jump. In 2016 we had 0 Silver Award winners. So I think the Baldrige Principles and the hard work that all of you are doing is really starting to pay off, and certainly we saw that this year with 5 Silver Award winners. And I'm delighted to say that 3 of those Silver Award winners were with assisted living and personal care members. So I think, for those of you that are assisted living and personal care members, as we go through the Silver process and the application, you'll fairly quickly maybe identify some challenges or some opportunities for you as assisted living and personal care providers. But I'm very comforted to say that, certainly the fact that 3 of our 5 Silver Awards in Pennsylvania being assisted living personal care members is a way to say to all of you it can be done. So Wendy covered the objectives for us, so we're just going to jump right into the content. So I thought it was important to just briefly talk about why there's different levels of the quality award process, and what does each level really mean, and what's the goal. So as you all are aware, the Bronze Award really helps describe who you are as an organization. You provide your mission and your vision. You outline how you go about improving your processes within your organization. You identify opportunities or challenges, and you recognize the ability to achieve performance improvement at the end of the application by giving us a sample of an outcome. So for the silver, it kind of goes up a notch, if you will. The Silver Award applications actually provide an extensive assessment of how do you use systematic approaches to improve your performance measures, your processes, and then as you get to the results section, how do you link all of those things that you do to your key customers? How do you identify what your future requirements are? And how do you determine your success factors and your future challenges? So you can hear, just based on that description, that it's a little less black and white, and there's a little bit more to being successful in achieving that Silver Award. Then for those of you who are already starting to think ahead of silver, or maybe you have a group in your organization, you have some Silver Award winners and you're considering going for gold, the Gold Award recipients really demonstrate how high performance is done. And by that I mean demonstrate means you not only tell the examiners in the form of the application, but there's actually an on-site visit. And so that's really when it's the show me. Show me how you're using the Baldrige Principles to be a high-performing organization. So before we get too far, a very common question for Bronze Award winners is, how long do I have to achieve the silver level, and what happens if I don't achieve it the first year? So Bronze Level recipients have 3 years to apply for the silver. If you're not successful in achieving the silver level, you can continue to apply for the silver, and it kind of the deadline extends. One way for skilled members to look at that is through the Trend Tracker top line report, which we'll talk about again in a little bit. If you're a bronze winner and maybe you're not sure because you weren't with the organization when they applied, if you're not sure of if you're active or past bronze, in an active or past status with PHCA for the bronze level, they do have those on the website as well. So if the 3 years has gone up and you haven't applied for the silver, you would be listed as a past recipient, and then you would have to repeat the bronze application and apply for silver the following year. Similarly, if you are already in a silver status and maybe you've taken a few years to kind of wait to move towards that gold, the same rules sort of apply. And I know we have a few members who definitely have been silver for a few years and are considering going for gold versus repeating their silver. So that's the reason for that being in the presentation. I think one of the important things that is really essential to understand, while we all like to get that letter and the notification of achieving the bronze or the silver award, there's so many other benefits to utilizing the Baldrige Principles. One of the things is that it provides a common language that you can utilize across your entire organization. So sometimes quality can be siloed as, oh, it's a clinical thing. This really is not just looking at quality from a clinical perspective. Baldrige looks at being a high-performing organization across your entire organization. So it's, maintenance, it's dietary, it is everyone. And so this language provides that common tool. Accountability. So it does help an organization look at what's important to the organization, based on the process categories, what's important, what do we do, and how do we do it. And then it also helps you look at, okay, we've done it, are we being successful? And I think that's one of the biggest pieces for the Silver Award application process, is when you're writing that application, really taking a step back and looking at, do we evaluate how we are doing in our process? So a common example is maybe resident council. You may have resident council, but do you evaluate, is your resident council being as effective and as efficient as it could be, as one example. The Baldrige Principles also can be utilized as a sustainability tool. It helps the management team describe how the organization operates. So you can use this if you're on a skilled area in your facility assessments. You can tie it to your QAPI plan. For our assisted living and personal care, that's a way to help you develop your quality programs that many of you are working on. It also serves as an improvement tool. So as we go through today, you're going to hear different questions that are in the application. It certainly gives you the opportunity to self-assess, how are we performing as an organization. In addition, if you apply for the Silver Award and you're not successful that first time, you'll get a feedback report. Now, I want to caution you, if you get that feedback report, you don't want to just tuck it away and not look at it for another 9 to 10 months. One of the things that you want to do is use that feedback report to build an action plan, because the examiner has identified something that may put you at risk from a quality standpoint, from a regulatory standpoint. So you really want to take that feedback report and do something with it. So many times folks will just kind of file that away because they're really disappointed. So I would encourage you, particularly if you're an organization that has submitted a Silver Award and maybe you didn't get it this year in 2017, those reports are due out August 18th. So when you get that feedback report, really look at it. If you need help translating it, reach out to me, reach out to someone within your organization. I know many of the companies have some folks who are examiners like myself. So you really want to use that feedback report as an improvement tool. It also helps organizations to align themselves. Many times when we look at system breakdown or work process breakdown, it's because organizations are working in a silo. Maybe housekeeping doesn't realize the impact of a change in a cleaning product that can result in something clinically. So how do all of your departments and your processes interrelate? So it helps the organization to align. And then it also can be used as a recruitment and retention tool. I know in working with a lot of our members, workforce is one of the biggest challenges you all face. And so, certainly using the bronze and the silver application process to, one, engage your team, but two, to recognize that you are a high-performing organization, use that as part of your recruitment and retention efforts. So the other thing is HCA has done a data analysis of, on the skilled side, how do quality award participants, particularly at the silver level, compare to non-participating members. And so you can see, I'm going to go through this very quickly. This data is actually data based on 2016 applicants. You can see that the HCA Quality Award recipients are doing better with rehospitalizations. They're doing better with the decrease of off-label use antipsychotics. Their occupancy rates are higher, and they're doing better financially. So that kind of just gives you the foundation of why I think the Baldrige Principles are just so beneficial for you as an organization. And then again, that silver award is kind of like the Super Bowl trophy. We've got to play the season to win the award. So we're going to jump into the silver application. Now I'm going to kind of just give a caveat here. The information that you're going to hear today is based on the 2017 application, and you'll see the schedule for 2018 in just a few slides. But I think the thing to keep in mind here is the concepts and the categories are not going to change because they're all based on the Baldrige Principles. So the questions may be reworded slightly, or you may see some additional questions or some change in questions, but the overall categories are going to be the same. And I would encourage you, as we go through the next 30 to 40 minutes, you kind of use this time almost as a quick self-assessment to say, okay, how are we doing on some of these things? And as you continue to make the decision to apply for the silver, what are opportunities that you have to really maximize the next few months? I do want to say that last year at our convention, we did a similar presentation, and a lot of our members said this was really good, but we wish we would have had this information in July. So some of you may be saying, well, why are they doing the webinar before the 2018 criteria? Well, we're doing it based on member input because they thought that this content was important to get out early, and then any changes in the application we can do in a follow-up webinar or in a workshop. So all that being said, one of the first things you're going to want to do, particularly if you've not looked at the silver application, is I would pull off the silver application for 2017 and just take a quick look at it. There's policies and, of course, eligibility requirements. I've already mentioned that nursing centers can use the HCA top line report to look at where are they at from a point standpoint from survey, what are they eligible for, and there's a nice little section on that report around the quality awards. Now, keep in mind your points for survey could change before the deadlines, that sort of thing, but it'll give you a quick, at a glance look. The elements of the application include an organizational profile, which is usually about your first 5 pages of your silver award application. So for those of you who probably still have your bronze application fresh in your mind, you know that the bronze application was a maximum of 5 pages. So one of the first things you can do is, pull out that application and look at how has our organization changed and kind of redline your current application. And then when the 2018 silver application comes out, you can look for taking and really just cutting and pasting from your bronze into the silver application. I would just caution you to make sure you answer the questions, and there's going to be places where you can give an abbreviated answer in the organizational profile, and then you'll go into more detail in the categories, which we'll talk about in a few minutes. So again, usually no more than 5 pages on that organizational profile section of the silver. The rest of the silver application looks at 6 Baldrige interrelated process categories, and I'll go over those in a minute. And then the 7th Baldrige category is on the results section. I have results here because that is a very important section of your application. There's several different categories of results, and it's also heavily weighted when it comes to scoring. So we'll go over that in a lot more detail today. And then I would encourage you all to consider coming to a workshop later in the fall. The other thing that you're going to want to do is review the application deadlines and submission process. I cannot emphasize enough, and I know you all have very busy jobs, but don't wait till the last minute to complete your application. Truly, if you wait till the last minute, you probably will not be successful in receiving the silver award. It's really, I've worked with different organizations who maybe weren't successful for the first time, and then they use that draft or that application that wasn't successful as a draft for the next year. So really trying to get some thoughts to paper very quickly and then evolving that over, the next few months is really the best way to be successful in achieving the silver award. So right now, HCA has just a generic application timeline for the award cycle in 2018. As I mentioned, the 2017 cycle is just wrapping up. So silver applicants will be getting their feedback reports if they were not successful this year. I think they're wrapping up the gold site visits. Now, they may have been announced already. But anyway, so they're doing the wrap-up of 2017. So in August, which actually is just days away, they will publish more detailed guidelines for us. The intent to apply opens in September, and again, this is part of the reason why we are doing this webinar now. The intent to apply is just going into the computer and saying, you intend to apply, there's a fee, but the advantage of doing the intent to apply is that it does give you a discounted rate on the application. It also gets you onto the PHCA NCAL email list to receive tips from the awards team, and so there's a lot of advantage to applying for that intent to apply. In December, then, the 2018 applications will be available online. So usually about the time that the intent to apply opens is when they make the applications available to us. And I will say that last year, while the questions stayed the same, there were changes in the results section where they gave us some required measures that folks had to submit on. So there will probably be some changes this year. And then the final application deadline is usually late January, early February. Last year, I think it was in January. The year before, it was in February. So, those specific dates will soon be made available. But at least it gives you kind of a month by month, okay, we should do this now sort of thing to start building out your plan. Just a few highlights from bronze to silver. With the bronze level for the nursing facilities and assisted living personal care, there were 2 different applications. With silver, it's all one application, or at least historically it has been. And so for ALPC folks, you really want to call out and read those note sections that they'll say ALPC. A lot of their language is just assisted living, but you want to really focus in on those. And then particularly with the results section, as you can see at the bottom here, you as an assisted living personal care member may not be tracking all of these things. So if you're not, you have to put something in that is similar, and we can talk about that at a later date. The other thing you're going to want to notice is, as you know, the bronze application was 5 pages. The silver application historically has been 25 pages. So there's quite a bit more content to work through. Some of our members that have been most successful in achieving silver they've really done this as a team, utilizing a team approach, and then someone being the point person to kind of be the author, if you will. And lots of proofreading. You want to build that into your project plan. We did have a member, I think it was 2 years ago, who they were disqualified because in the proofreading process somehow they lost a category, and so they couldn't be scored, so they were disqualified. So you really want to take all of those things into consideration as you're establishing your plan. So step 1, and this is an area when I'm out working with members where they've identified a common kind of barrier is that when they move from bronze to silver, they need to really think about the language of the Baldrige Principles. And so for the majority of our time yet today, we're going to go through the Baldrige Principles so that you can kind of start to understand a little bit more deeply the terminology and what actually you should be thinking about entering in your application for each section. So the Baldrige Framework, again, looks at all components of your organization and really embraces a systems perspective. The purpose of the Baldrige Framework is to analyze organizational performance. So again, it's that self-assessment, that opportunity to improve, quantify performance through results, the results section 7, and identify areas for improvement or change. As an examiner, I think one of the biggest areas that people sometimes miss is looking at the future perspective in some of these questions. So you may do a very good job of describing what you're doing now, but you may not evaluate, is that effective and how are you going to continue to sustain or build for the future. There are some sections of the application that call that out specifically. And again, you'll hear me say this a couple of times. It's really important to answer the question as worded. And I'll give you some examples of that as we move through. So the Baldrige focus areas include core values and concepts. Again, some of that will start in your organizational profile with your mission and your vision, your beliefs, your behaviors. But then they do ask you to say, what are your core values of your organization? How does your leadership team execute on those core values? How do you move those into action? How do you tie your customer service program to those core values and concepts? Process. How do you do the work that you do? And we're going to talk about category 6, operations. Many folks miss that when they get to that section, we're looking for a work process. How do you do your linen service, your laundry service? How do you do dining services? They're the processes that we're looking for there. Results. This is a very, very important concept. And as I mentioned, the results section can sort of make or break you, to be quite honest. So you want to have that internal view for the required elements. Are you collecting that data? And I do know that sometimes I'll have an organization reach out to me and say, we're not collecting all of this data, so we're going to start collecting that now, and we'll apply the following year. So are you collecting the data internally? And then do you have an external view? So it's not comparing yourself to other sister communities or sister nursing homes. This is, do you have data outside of your organization? One of the things that they teach us at examiner training is if you are comparing yourself to others within your company, if you're the worst of your worst, then you're not necessarily performing at a high level. So it's very important to look at that external view. For nursing centers, it's pretty easy to find that comparative data. For assisted living and personal care, we have to work a little bit harder. And one of the things that I would encourage you to think about is if you are going to apply for the silver and you haven't already implemented long-term care trend tracker, I would really consider doing that very, very quickly in your project plan, because long-term care trend tracker is going to be a very valuable tool for you to have that comparative data. And then also, as you're looking at your results, that future view. So, of course, for our nursing centers here in Pennsylvania, we have community health choices, we have new payment models. How will your results play into what's it going to look like in the future? And then the other thing is linkages. How does everything that you're doing in your organization tie together to make it a high-performing, systematic approach? So these are the Baldrige core values and concepts. And the reason I put those in here is, one, I think many of them align to maybe your core values and concepts, but you'll also see these core values and concepts integrated into the Silver Award applications. And so when you look at the society responsibility and community health, there is a question, how do you as an organization contribute to your community? I know all of you are doing, community-based projects, that sort of thing that might be, community events, or maybe you host different education sessions. So they're the sorts of things that you would include. So, you can see that these really do cover an organization in its entirety, and then, they're looking for your systems that support those different categories. So this is what they call the Baldrige hamburger, and you can see the top layer of your bun is the organizational profile, which is, again, your bronze application. You then have leadership category, strategic planning, customer focus, workforce focus, operation focus, and measurement, analysis, and knowledge management there at the bottom. They're the kind of interrelated processes, and then all of that, of course, feeds into your results, which, again, takes you back full cycle to kind of re-looking at how is everything going from an organizational standpoint. These 7 areas make up the 7 categories in your application. And so we're going to go over each one of those categories. So just to kind of recap this slide, again, your organizational profile is your bronze application, that for your silver application, you'll just update, and then you'll work through systematically categories 1 through 7 to answer those questions, and then 7 will be providing the results. So category 1 is leadership. The general areas covered in the leadership category is vision and values. And again, you'll have the question and vision from your bronze application in those first 5 pages, but you'll be asked questions that will dig a little bit deeper into vision and values. Promoting legal and ethical behavior, communication. A big area that organizations don't necessarily score well on is how does leadership focus on action. So how do you move from concept to action as a leadership team in your organization? Governance and then societal responsibility. So before we get into the individual questions, I just kind of want to give you an overview on some things to look for. And this is an area where, again, sometimes we have a lot of questions. So you'll see that there's a basic item requirement: how do your senior leaders lead the organization? There are going to be certain categories where you're going to have a few sentences listed there, and then there's going to be other categories where that question may be answered in the overall required items. There's not a cookie cutter approach there, but generally what I've seen done fairly successfully is you answer that question, that basic item question at least sort of like an introductory sentence or 2, and then you'll provide the specific details in the overall item requirement. A couple other things that I would encourage you to think about is read each question carefully for keywords or phrases. So an example that we're going to talk about in a minute is personal actions. Focus on action. So you really want to kind of hone in on those questions where there's specific details to what the examiner is going to be looking for. Also, the words that have capital letters like senior leaders, that means that in the glossary there is a definition for how you should answer that. So some keys in the application to help you more successfully respond. So the first category, again, is leadership. How do your senior leaders lead the organization? One of the first thing I'd recommend is giving a definition of who makes up your senior leadership team. So generally in a nursing home, it's probably the administrator and maybe the DON, or it might be the administrator and all department heads. But sometimes we'll read an application, and in 25 pages, we're never really sure who the senior leader team is. So that's one of the things that you could put in that first question. Then how do senior leaders' personal actions build an organization? The key here is personal actions. This is how do you as a senior leader do what you do, and that's really important. It's not, well, company X does this. It's, okay, well, I'm the DON or I'm the administrator and I do certain things. The other question that people get hung up on sometimes is that focus on action. How do you create a focus on action? Do you do, maybe there's a fall, do you do an immediate meeting? Or if you had a abuse neglect allegation, how do you focus on action? And then also, how do you do that proactively? Maybe through your strategic planning. So you'll answer strategic planning more general in the strategy category. So one of the things that you can do is refer to other sections of the application. So in this case, if you're going to address how does the senior leader move strategy into action, you can refer to category 2 dot whatever. So you can do some linking of the application that way. Category 2 is strategy. You can see the questions here again. You have what are your strategic objectives? and action plans. One of the barriers sometimes in the silver level is the strategic objectives are not well written. And by that, if you think about how do you write a goal, you use SMART goals, that sort of thing. You'll want to make sure your strategic objective is an objective and that there is a timetable. And we've often seen this in the form of a table, which is fine, but just really use that SMART methodology when you're doing your strategic objectives. Also, and I apologize, there's a little typo here, do the strategic objectives specifically align with and address any challenges that you've identified in your organizational profile? Again, we do some crosswalking as examiners to say, okay, well, they've identified workforce as a challenge. Well, is that addressed in their strategic objectives? And then can you show evidence of evaluation of the strategic development process? So, some organizations may only do strategic planning every 2 years or whatever. Do you evaluate that that is still an effective timetable to do your strategic planning? Or is there a lot going on and maybe you need to increase that frequency? So how do you determine, that your process is working? Considerations here, again, the strategic plan must look at the overall organization. How do you look at your healthcare service? And with the bronze, you have those services outlined, but again, are you looking at doing things for the future? How does your strategic plan tie to the processes for patients and customer engagement? We're going to talk more about customer engagement in just a little bit. And again, make sure your strategic objectives are measurable. Strategic planning, this year for some reason, strategic planning was not well defined in, I think maybe of the 6 or 7 applications I reviewed, one organization really did a good job of describing their strategic planning. So again, I put that in here, the definition and the purpose, to kind of help you just think through. It may not need to be very formal. It may be an informal process, but as you're describing it in the application, just make sure you're hitting, what you do from a strategic planning standpoint. Customers, this is category 3. A key component here is, 1, to address your customer types. And I'll call out here, while your workforce is a customer, your workforce questions and responses will be in a different category. So the customers they're looking for in category 3 are your residents, your families, your referral sources, those customers you identify other than your employees. And I bring that up because oftentimes the two get blended or it's in the wrong place. And so obviously as an examiner, we have to tease out, and sometimes we have to give a lower score because if you address workforce here, we can't use that as customer. Now we try to give you credit in the workforce category, but you can see it kind of gets gray, and we obviously want you to get the most points possible. The other thing to watch for are multiple part questions. In the customer question, they're looking for how do you listen, interact, and observe customers to obtain actionable data. So listen might be through your resident council. Interact might be maybe you have an ambassador program or something like that where you're interacting with new residents on a regular basis. And then how do you observe? And that might be in the dining room, you're observing that maybe the residents are sending back full cups of coffee, and you're wondering, well, why are they not drinking their coffee? And maybe you recently had a brand change or something like that. So observation. Again, looking at comparative data. So one of the ways that you can get comparative data is if you use a third-party customer satisfaction company. Also, some of those customer satisfaction companies download information into trend trackers, so you can do some benchmarking that way. And then you also want to address both customer satisfaction and customer engagement. I'm going to move through this slide because we've kind of already covered the satisfaction part, but I do want to just spend a minute or two talking about engagement. Customer satisfaction and customer engagement are different, and these next few slides are going to kind of go through that. So customer satisfaction is the number of customers or percentage of total customers who had an experience with your business. And it, kind of measures, did you exceed their goals, or were they just satisfied? Customer engagement is a little bit more complex, and it sometimes I think is a little bit harder to articulate in the application, and maybe a little bit harder to demonstrate a result. But customer engagement really looks at brand loyalty. What is that customer's willingness to participate with you as an organization? So there have been some studies done that look at customer engagement, and a fully engaged client recommends a brand nearly 4 times. So do you have a way of maybe measuring folks who have been discharged from your community if they have if they refer anyone? Do you have a referral program? 13% of fully engaged clients post to social media. So again, many of you probably have websites and that sort of thing. Do you have a way to give that customer, collect that customer engagement that way? And again, the social media, I think, is a really important piece for customer engagement in this day and age. So the question historically here and around customer engagement is, how do you engage customers by serving their needs and building relationships? Some other questions in this category include, how do you determine healthcare service offerings? So again, how do you take a look at your service area and anticipate what services you may need to continue to provide, maybe phase out, and what are the things that you're looking to provide in the future? How do you build and manage customer relations? And then the customer complaints. I'm just going to hit the customer complaints for a minute here. In that one of the areas that hang people up in customer complaints is around not evaluating the process for customer complaints. And so again, you may have a process in place, but if you have no customer complaints, my question would be, are you providing that high level of service, or are people not aware of your complaint hotline, or however you're doing it? So really, again, think about how are you monitoring those processes to make sure they're effective and efficient. Category 4, the thing I want to highlight here is Category 4 is not where you put your results. Category 4 is where you tell the examiner how you collect that data. Where do you get, what are your data sources? And then how do you use those findings to improve performance? We've already covered around comparative data and that importance. Your key performance measures, I would encourage you to look at the definition. We'll go into that in much more detail in the workshop, but people get hung up on their key performance measures, tying those to the strategic objectives, and the two may not be the same. So you want to kind of hone in on that. Sometimes people really do not do a very good job in this category, and I think they just get hung up on trying to explain what the questions are asking and not kind of pulling in too many other things that you're going to refer to in Category 7. Workforce, again, with workforce, it looks at how do you build an effective and supportive workforce environment. A big piece here in your overall item requirement is the difference between capability. So does your staff have the skills and the knowledge to do the job versus capacity? So they're two different things, and you need to address both areas in your response. The other thing that folks get hung up on, and again, it's the multiple kind of parts of the question, how do you recruit, manage, and retain your workforce? Many times people do a really good job of describing their recruitment process, but they don't tell us how they manage and retain. Now, maybe management you've covered in the leadership section and you can make that linkage, but that retention piece is very important. We all know the value of retaining employees, so covering that is an important piece, and many times that's missed when folks are responding to the question. Engagement. Here's the second place where we're going to talk about engagement. And the important thing I think to keep in mind with particularly employees and engagement is there's certain cultural attributes of an organization that have higher levels of organization. So does an employee have a clear sense of purpose? Are their managers people-focused? Is there meaningful connectedness? So, does that employee feel a connection to their organization? We hear stories of nurses' aides walking long distances because they want to care for their residents, and they really just go those extra miles. They're connected. Active voice of an employee. Do you have a way for your employees to be active? And not just once a year for an employee satisfaction survey, but are they bringing ideas to you? Are they empowered to make change? And then visible integrity. Does the leadership team and does the organization really hold true in a day-to-day behavior to their mission and their values? Engagement is more that emotional piece, and so we sometimes, I think they gave us the example at examiner training, I may be satisfied as an employee if I have the opportunity to leave early for the day, but that doesn't necessarily mean I'm more engaged. So just kind of keeping that in mind. Again, here's some of the questions, and you can spend some time just going through and say, how do we do as an organization in answering these questions? Operations. The big piece I want to call out here is work processes. We have actually seen where sometimes we cannot score this section of the application, even if there's text at its fullest value, because people are not giving us work processes. They may talk about services, but they're not telling us about their work processes. So I want to talk a minute about what a work process is and give you some examples. So work process might include product and service design and delivery, customer support, supply chain management. So examples that come to mind to me are your laundry services. If you are finding that maybe you're running out of clean towels or linens, how can you, that's a work process that you can certainly run through your quality process and, make a change. Dining services, those sorts of things. So it's the processes that support you, and we often will see non-work process information in this category, and again, it brings down the score. The results section, you can see there's different categories. There's 5 different categories of results. In 2017, HCA surprised us all and gave some required measures that folks had to provide results on. Again, if you were an assisted living or personal care, you don't have 5-star data. So what the requirement was that you substituted something that was related. So if you don't have a 5-star staffing measure, you may, put in staff satisfaction, that sort of thing. And so anyway, you had to put some sort of substitute in there for ALPC. And I know I had a few questions that came in about that, so we can, talk about that a little bit later. When the examiners review the results section, they're looking at 4 categories. One is the level of performance. So 1, is the measure meaningful? In your results section, you need to say your source of your data, explain your data. Don't expect that the examiner understands it. We might have an examiner that is from an assisted living scoring a skilled nursing center, or vice versa, or some of the examiners are actually experts in Baldrige, so they may not be healthcare folks. So explaining your data becomes very important, and why is it meaningful? Looking at those trends, is your data headed in the right direction? Comparative data, I've hit a couple of times. I can't emphasize the importance of that comparative data. It really becomes an important part of how we evaluate Section 7, and then integration. Are those results meaningful? So you might be talking about a short stay rehab and how that's so important to the vision and strategic plan. And if you give us nothing in the results section and you start just cherry picking other sorts of measures, we can't necessarily tie that back to your application. One of the things as examiners that we do is as we're reading the application, we start a list of what results do we expect to see in Category 7. And so that's, again, where, you know, we crosswalk your entire application to Section 7. Here's just some of the concepts, and you can actually use these questions as you're putting your results section together. So that for the next few minutes, I just want to cover some of the common pitfalls, and I'm going over a lot of information in an hour. I can't encourage you strongly enough to take the time and try to come to a Silver Award workshop where we'll dig deeper and into all of these categories. But for this introduction, again, you know, one of the biggest blockers is around the learning dimension of our scoring, and that is, are the organizations evaluating their processes? And so in the workshops, we actually do some activities around this, but you can see the different categories that an evaluator goes through. How does your organization approach designing and selecting your process measures and your methods? How do you carry that out consistently across your organization? You have to blend kind of telling us about your systems and your process with examples. Sometimes there's a lot of words without a lot of substance, and so you kind of have to blend your approach with kind of giving us some meat on the bones to tell us that, yeah, we're really doing this. Evaluating those processes, and then how do you integrate that across your organization? So just common pitfalls. Your application will not get to an examiner if you don't meet the technical requirements, and you will not get a feedback report. So it's kind of a wasted year. So really spend time making sure you meet the technical requirements. Utilize the application form checklist. In last year's booklet, it was on pages 16 through 18. Again, utilize the guidelines, the terms. Make sure you're answering the questions. Look for what's a process item versus a result item. Assume that the examiner does not know anything about your organization. We cannot assume or make assumptions. We have to just take your application for what's on that piece of paper. And a big thing, again, in this year's application was so many people just really didn't answer the question. Again, make sure that you're linking things to your overall organization and look for those kind of connection points. And a lot of folks use tables very effectively to help with that. And again, at a workshop, we would kind of go through more examples of what that would look like. Final step really is to formulate a plan. I think one of my favorite pictures is here on the left, where clearly someone failed in their Baldrige Principles. You can see that the bridge is no longer effective because the body of water has gone around the bridge. And so, you know, somewhere along the line they didn't evaluate that. And or, you know, do you want to be a very highly effective bridge, as on the right, where there's cars and there's bike lanes and there's, you know, a lot going on. So formulate your plan now. A few things that I would recommend you do very soon is, one, know your PHCA website and access. PHCA cannot give you your username and password. We can give you access to the PHCA website, which is another source of information for you. But for PHCA, you actually have to go through PHCA. Sign up for the Pennsylvania Healthcare Association daily updates. As the award cycle, you know, ramps up, we do little stories. We, you know, announce the deadlines. So if you're not getting our daily update, I would encourage you to you know, let us know. Begin to develop a project plan. Do the self-assessment using these questions, or I do have a more in-depth self-assessment that PHCA piloted last year that I'd be happy to send you. You can just email me. If you are a prior Silver Award applicant, use the feedback report, create an action plan. If you need help translating, reach out for help with, kind of the language of the examiner, and then watch for the more detailed timeline. Couple of words of caution. Remember, and I know we're only in July, but we have some major holidays coming up through the Quality Award writing time, so you want to make sure that you plan for that. You also want to plan for surveys. If you're in a survey window and you know you're going to lose a week in your project plan, you want to build that into your plan. A lot of organizations who are successful will do, each category and then create action items and follow up. So, I think organizations who really use a team approach to this are most successful in achieving the silver. I've mentioned the Silver Award Workshop a couple of times. We do have a date on hold for October 30th, and when Wendy sends out the follow-up questions, one of our questions will be, do you have interest in attending the October workshop? Like I said, that is a lot of information in a very short period of time, so I think we have about 5 minutes for any questions. And Wendy, I'll turn it back over to you.
Great. Thank you, Dawn. That was great information. We had good attendance today. Really appreciate all of Dawn's good information. We love to pick her brain here because she's so knowledgeable and she's very helpful, as I'm sure all of you have found. And if you haven't used Dawn as a resource, we would encourage you to do so. So if there are any questions at this time, please use the question pane on the right-hand side to type in your questions. Otherwise, we'll wrap up, and like I said, I'll be sending out the certificates and the link to the recording, as well as Dawn's contact information, the October 30th date, among other things. So if there are any questions, please type them in now, and we'll get them answered for you. All right, we'll give it another minute or so. There aren't any questions currently, so looks like we're going to be wrapping up here. Give you a couple extra minutes in your day. Don't forget to complete the survey that we'll be sending out. That information is really helpful for us in planning future webinars. And the recordings for any of our past webinars, they're always recorded, and we do place those on our website. They are accessible on the website. All right, I'm not seeing any questions, Dawn, so thank you again for the great information and presenting on this topic, and everybody have a great day.
Thanks, Wendy. Thanks, everyone.